racing. The sweat is dripping down your forehead. The walls are quickly closing in on you. Your vision's getting blurry, then black. This is the reality of those who suffer with the intense feelings of having claustrophobia, one of the many phobias that affects people today. Phobias can feel scary, overwhelming, and uncontrollable. According to Johns Hopkins Medicine 2024, about 19 million Americans have one or more phobias that range from mild to severe. I first realized I had a phobia when I was first introduced to cotton balls. People may think it's hilarious for me to be scared of something as harmless as cotton balls, but what most people don't realize, a phobia like this can make you feel like you want to crawl out of your skin and can cause this disoriented feeling like your teeth are static in your own mouth. That's just a small fraction of what one can feel when they have a phobia. Today, we're going to explore the psychology behind phobias. Then, we're going to creep on over to the brain's role in phobias. Lastly, we're going to investigate how people can overcome their phobias. Phobias may feel like a difficult subject to understand, which is why it's crucial to break down the root causes. A phobia is defined as an uncontrollable, irrational, lasting fear of a certain object or situation. According to the Cleveland Clinic in 2023, people may experience intense or overwhelming fear, panic, the feeling they need to escape, feeling like they're in immediate danger, and feelings of disconnection from their own body, which is known as depersonalization, or disconnection from the world around them, which is known as derealization. Many people may not think there's a difference in between fears and phobias, but what they don't know, a fear is a common reaction to an event or situation. A fear can become a phobia, but it has to interfere with your ability to function or maintaining consistent quality of life. If you start taking extreme measures to avoid a certain object or situation, you may have a phobia. According to an article written by the UK National Health Service in 2022, phobias can develop during childhood, adolescence, or early adulthood. They can be linked to frightening events or stressful situations. For example, if you're trapped in a confined space when you're younger, you can develop a fear or a phobia of confined spaces when you're older. However, it's not always clear why some phobias occur. According to Boston Children's Hospital, there can be many factors that play a role into your phobia, including environmental, biological, and genetic factors. Phobias can cause you to experience symptoms when you're exposed to or even thinking about the stimuli. When you're away from the stimuli, you recognize that fear is so much severe than it should be. If you encounter that trigger again, you'll feel overwhelming fear and anxiety again. An article written on February 22, 2022 from the Cleveland Clinic states that phobias have a long-term effect on your mental and physical health, especially when you frequently encounter that trigger or have especially severe effects. Though the roots behind phobias are vital, the physical presentation within the mind and body are just as important to look at on ways phobias impact people. While we may try to hide our fears, it can be truly working within our brain and wreaking havoc on our nervous system. According to Neurology Live in 2016, phobias are associated with major alterations in brain activity. Individuals who suffer from phobias have been shown to display increased activity of the amygdala when exposed to phobia-inducing stimuli. Your amygdala is a small part of your brain, but it has a huge job. It's a major processing center for all your emotions. As soon as your body recognizes a phobia, your amygdala goes to work. It sets your body's fear response into motion. Stress hormones like cortisol and adrenaline release, your blood pressure and heart rate increase, you start breathing faster, and blood actually begins to flow away from your heart and into your limbs, making it easier for you to start throwing punches or run for your life. One observation is the right amygdala is highly reactive to negative emotions, such as those associated with phobias, while your left amygdala is more associated with pleasant emotions. Interestingly, a study by the National Library of Medicine study, they said that the higher activation of the right amygdala, the longer lasting impacts could be on your behavior. This area is also composed of the stria terminalis. This provides pathways sent from the amygdala to the hypothalamus. This interprets stress signals, as cited by Harvard Health Publishing 2024. The striatum terminalis is also composed of the anterior cingulate cortex, also known as the ACC. This is important for attention, emotion, and impulse control, which can cause you to act in ways you typically wouldn't during exposure situations. Lastly, the insula, Latin for island, is a small region of the cerebral cortex that is important for tasks such as sensory motoring, autonomic processes, and pain pathways, which can all go to overdrive during panic situations. All of these are found to be hyperactivated in individuals who experience sustained exposure to phobia-inducing stimuli. In the same National Library of Medicine study, they suggested that prolonged exposure to phobia-inducing stimuli without proper exposure methods could actually engage more areas of the brain, inciting physical responses. These physical responses may feel life-saving in the moment, but over time could have a drastic effect on your health, as our bodies can't stand in being in fight or flight long term. Because of the internal and external battles, those living with them feel like they can never overcome them. But there are now tested ways to help resolve some of these daily challenges. First, I will talk about desensitizing yourself. This means you can become less and less affected with a safe, controlled exposure. In an article written by the University of Michigan, one way to do this is creating a fear hierarchy, or also known as a fear ladder. This starts with exposure that is very small at first, and exposing yourself more and more to the feared object or experience. This helps the brain unlearn the fear responses over time with a safe, controlled exposure. However, according to a National Library of Medicine study in 2021, that those few people that seek treatment from doctors, only 20 to 30% reported they seek helpful treatment from doctors. Not receiving results from doctors may feel discouraging finding any form of treatment though. This may be because the doctor's likelihood to prescribe common anti-anxiety medications when advanced therapy treatments is typically necessary. An example of an advanced treatment route is known as eye movement, desensitization, and reprocessing therapy, also known as EMDR. This is when doctors make you stimulate both eye movements while reliving the experiences. This helps loosen the fear response over time, intense emotions, and the vividness of the memory. According to an article written by the EMDR International Association on December 19, 2024, this study has proven to help patients recover from PTSD symptoms and trauma symptoms. If seeking doctor intervention is something a patient doesn't want to do, another suitable option for treatment is finding an online or local support group to help work through your phobia and find others that are going through experiences. Because phobias can limit your daily activities and cause severe anxiety and depression, choosing one of these treatment routes is typically a necessary step to a healthy lifestyle. But the first step must be seeking it out. Phobias have a huge impact on those living with them, and many do not seek help or have the means to do so effectively, so many may choose to live their lives hidden. Phobias can affect one's relationships. For those of us living with phobias, whether that be enclosed spaces, spiders, or even cotton balls, somebody would benefit from the comprehensive education on this disorder. Today, we explore the psychology behind phobias, then we creeped on over to the brain's role in phobias. Lastly, we investigated how people can overcome their phobias. Phobias may feel like a formidable enemy within the mind and body, but education can help improve the lives who weather the daily storms of this disorder.